Assalamu alaikum. Welcome to the channel. This is the third video of insulin course series. In this video I would like to talk on how much basal insulin should be started and continued when we decided to start the patient on basal insulin, and what will be our target after starting basal insulin. So let's begin. We can calculate basal insulin dose by using two formulas. One is weight-based and other is Holman-Turner formula, which is based on fasting blood sugar. Weight-based formula is multiply weight of the patient with 0.1 or 0.2, but it is better to start with 10 units of basal insulin. You can give basal insulin at any time of the day, but it is better to continue it on same time of the day. Suppose weight of the patient is 100 kg, so 100 multiplied by 0.1 is 10 or by 0.2 is 20. So you can start with both, but starting with 10 unit is better. Holman-Turner formula is fasting blood sugar minus 50 divided by 10. Suppose fasting blood sugar is 250, so 250 minus 50 divided by 10 is 20 units. So you can start with 20 or with 10 units. The target fasting blood sugar is 80 to 130 mg per deciliter. If fasting blood sugar is more than target, then you will increase 2 units of basal insulin on every third day. Always remember, you will increase basal insulin dose up to 24 units per day because insulin is released from pancreas as maximally as 1 unit per hour. If target fasting blood sugar or HbA1c target is not achieved with 24 units of basal insulin, then you will add bolus insulin. Thanks for watching.